Welcome back to the show, guys. We have an amazing episode for you today. The man who I am interviewing is a guy that I've been following for a couple of years. So when his team reached out to ask if I was interested in interviewing him, it was one of those, heck yeah, absolutely. And he is none other than Dr. Amir Karam. Now, if you've never heard of Dr. Amir Karam, you're about to. The man is somewhere between a technical genius and an artist. He's one of those facial rejuvenation physicians that has redefined the art of facial rejuvenation. So I'm really excited for you to learn a lot more about why we start to look old and what we can do about it. But before we do that, of course, I want to start by thanking you for being here. I would like to invite you to join me in celebrating over 3.5 million downloads of this show, which is amazing. And it's all thanks to you. Thanks to every one of you, new listeners who've been with me from the beginning, and everybody in between. Thank you from the bottom of my heart for listening to this show, for sending me your comments and your questions and all the feedback that I get that helps me to help you and as many people as humanly possible. So thank you for that. And then secondly, I'd love to invite you to come hang out with me. So there's a number of ways that you can do that. And all of them start with going to natnidham.com. So the first thing you can do at natnidham.com is sign up for my newsletter. If you are a new subscriber to the newsletter, you will get an 8-part series on preparing your body for things like bioregulators and more advanced anti-aging techniques. So that's just my gift from me to you. It'll take a couple of months to deliver the information. It's a lot of information, but you get that just for signing up for the newsletter. Secondly, you could look into joining my membership community. And you will find that under the community tab on this natnidham.com website. And you can check out the different packages. And we do amazing things in there. I do live Q&As once a week, pretty much. Every once in a while I'm traveling, I might miss a week, but if I'm missing a week, somebody else is in there instead of me. We also invite our podcast guests, some of them, not all of them, but we invite podcast guests to come in and do sessions with the members of the community. So members get to ask their questions live of many of the podcast guests. We also have resident experts. So experts in hormones, experts in thyroid, experts in the gut microbiome, people who come in once a month, run a session and answer your questions live. We do N of 1 experiments and we have a lot of fun. So if that is the kind of thing you think you might want to check out, then just head on over to natnidham.com and look at that community tab. And hopefully I'll see you on the inside. All right, folks, today's episode is all about the science of aging, specifically why we start to look older, what is actually happening under the surface, and what can we do about it. Our guest, Dr. Amir Karam, has spent years mastering facial rejuvenation and understanding what truly keeps a face looking youthful without looking done. It's not about chasing trends, injecting with reckless abandon, or piling on endless products. It's about knowing how aging really works and addressing it at the foundation. We'll be diving into the real causes of skin and facial aging, the biggest mistakes people make when trying to turn back the clock, and the smartest ways to keep your face looking fresh for years to come. And if you want to learn more about Dr. Karam, you'll want to visit drkaram, KARAM.com for more information. Hey folks, just a quick reminder that all of the information presented in this podcast is for information purposes only. No medical advice, no diagnosing, no treatments suggested here. Before you try anything that you hear about or learn about here, make sure that you check with your medical provider. Dr. Amir Karam, welcome to the show. It is an honor to have you here today.
Thank you so much, Natalie. It's a pleasure to be here. I'm so excited for our conversation.
Well, you have no idea how excited I am, because when your team, your PR team or whoever it was that reached out to me, I was like, get out. I've been following this guy for like 2 years. No, really?
That's funny. That's awesome. No, I love that. No, this is great. And obviously, we feel, the information and the stuff that you're putting out there is super valuable, and love to contribute and, give some insights to your audience as well.
I love it. That's amazing. I'm very excited. And, I'm wondering actually what you think about this. Like, I feel like your field has really evolved over the last, and I don't know how long it's been, but somewhere along the line, we stopped talking about plastic surgery and started talking about facial rejuvenation, which is such a different take. And certainly in the case of people like you who are doing work that, I think when you get the right person at the right time in their life and you work your magic, it's kind of, in best case scenario, people are like, wow, she looks like she had a really good nap. Like,
yeah, no, totally. Absolutely.
Put their finger on what's changed kind of thing. And those words, from plastic surgery, which by its language says we're doing something unnatural. Mm-hmm. So facial rejuvenation is a completely different sphere. And have you lived through that evolution yourself in your career?
Oh, no, 100%. I think when I got, I'll just give you kind of a quick history of this. Facelifts started in the early 1900s, the very first facelift that was performed.
Really?
Yeah. And it was a skin only type of a facelift. It was done, in the back of some clinic somewhere. It was not a field, Plastic surgery is derived from the Greek term plastikos, which is basically, to change, essentially. It's a concept of creating change. And the concept of facelifts and things like that, it was basically a very, minimal part of the field. Most of it was reconstructive. Most of it was sort of a totally different spectrum of surgeries. Mm-hmm. And then when it comes specifically to facelifts, the first major change happened in the mid 1970s when we discovered the fascial layer of the face, and that term SMAS that we keep hearing about was discovered in, I think it was 1976. So everything was there's literally no change. Everyone was just, if they did a facelift, it was just like skin, lift up a little bit of skin and close it. Yeah. And then they discovered the SMAS, which then led to really kind of an explosion of innovation, surgical innovation. But it was all anatomic. People were just finding different ways to address the SMAS.
I have a question.
Yeah.
What's SMAS?
Oh, SMAS is fascia. Basically, it's the it's facial fascia. We realize that underneath the skin, there's this layer that actually ages, and that's the term for that. It's an acronym, but it's basically the fascia that holds the face together. Right. It literally is like this, what gives the face shape. But the problem was that from the inception, even through most of the 70s, 80s, and 90s, the direction of the facelift was all horizontal, meaning it pulled the face towards the ears. Exactly. And even when I was training, all the surgeons that were my mentors and professors, et cetera, when I would watch them do their surgeries, everything was being pulled directly sideways. And I would watch the mouths get pulled, like widened, and the face looked flattened and all these other things. And I looked at all that and I thought, man, this is really kind of gross looking, honestly. Like it didn't, the outcomes looked terrible. What you saw on the table didn't make any sense. And I literally thought to myself, there's no, I'm not doing facelifts as part of my sort of scope of practice. I was going to be a rhinoplasty surgeon and a cancer reconstructive surgeon. And it was interesting because there was literally a small pocket of surgeons that were talking about vertically oriented facelifts, the vector, meaning going upward. And at the same time, this was early 90s, late 90s. And at the same time, there was this concept starting to become into our awareness about volume. The face loses volume. But there were literally like two different extremes. So there was like the camp that thought the face ages because it loses volume, like kind of a grape going to a raisin. And then there was a group that just thought it's all laxity and everything needs to be tightened. So they were doing, both these groups were doing it very, in parallel, basically. And neither of them had the answer. Neither one of their outcomes looked nice. Stuffing a face full of fat or, whatever wasn't getting the outcome, and tightening it up wasn't getting the outcome. So it was interesting because there was just little moments where I remember I thought, wow, this vertical orientation makes so much more sense, because this is like what people do to themselves. They lift their face upwards when they want to show, what they used to look like. They go up, right? And then, yeah, exactly. And then, there is obviously some loss of volume, but that's not the whole picture. So when I started to get into my end of my residency and fellowship, I decided I'm going to basically bring these two pieces together. I'm going to bring a vertical orientation to a lift and the volume aspect through fat transfer. And remember, at this point, collagen was the only filler on the market. So we weren't really talking about, Juvederm, hyaluronic acids they were just starting to make their debut.
Yeah.
So for me, it was vertical orientation and fat transfer. And I started doing these cases as a resident. And sure enough, and these were cases I did by myself without any supervision. I did them kind of my own way. And literally the results looked immediately natural and beautiful. So that was what made me think, okay, well, there is this opportunity to really rejuvenate a face and make it look like a younger version of the person and not make them look tweaked or weird or whatever it is. Mm-hmm. And that got my interest going. Simultaneously, more awareness around volume and things like that started to come, but it was mostly always coming through the way of fillers, as Sculptura and all these other things started to come into play. And really not until very recently, I would say, there was the ability to create a more natural looking outcome became a little bit more commonplace. It was very uncommon to have an unnatural looking outcome for truly up until very, very recently. And because things change slowly in the surgical space, because you get trained one way, and if you're a plastic surgeon who does breast and body work and liposuction and things like that, you're doing like 1 or 2 facelifts a month. So there's really no pressure for you to go out and try to innovate or keep keep up with the latest. You're just going to do what you were trained to do, and you can do safely, get in and out of that surgery safely, because it's a small part of your practice. But somebody like myself, it's for most of my career is either facelifts or rhinoplasties. Those were the two things I was doing, and until probably the last 5 or 6 years, all I do is the vertical restore, which is the facelift technique that I perform, but that's that evolution, and people seeing those outcomes also motivates other surgeons that they can create a more natural looking. So I think social media actually had a very positive effect in speeding up that aspect, because the patients demanded more than what surgeons were generally providing. And surgeons like myself who were posting their before and afters really did kind of set the bar at a new level. And either you have to meet that level or someone's not going to, you're not going to get a patient to come see you.
Yeah.
So we're seeing a lot of growth in that space suddenly.
Yeah. No, it's interesting, because I think that, the women the people who allow you to share their cases online are generous. Right?
So generous. They're amazing to share their journeys. Yeah.
Like, I think that by nature, myself, like, I'm a fairly private person, not that you would know it, because here I am talking to you and my face is going to be all over YouTube sometime. But when I've ever thought about this area, it all of a sudden I have all these feelings of, do I want to put this out in the world? Do I want people to know that I don't want to age? Because we are going to age, and it's a normal, you get caught in this you have this whole internal dialogue around the topic, which is, it's deeply personal and
hugely personal. Yeah, no, and what's interesting about that, just to kind of take off from there to provide a little insight. It occurred to me probably after about the 5th year of practice that what I do has nothing to do with sagging jowls and sagging necks, like zero. Those changes create such a bigger emotional and psychological impact on the person. And it makes sense to me now too, because it makes more sense to me now as my wife just went through it and I'm kind of getting older or whatever, that I can understand that there is this reality between the way you expect to look based on your self-image of yourself and how you actually look when a photo is taken of you or a video is taken of you. I still, to this day, like when my kids take pictures or whatever, with family photos and I see all my gray hair and stuff, I have to double take, like, oh, who's that who's that person in the picture? Oh, it's me. Literally, yeah, it's me. I'm in there because I see myself as a lot younger than what my picture shows. And that's what every single patient, and truly anyone who gets involved in this, broad spectrum of facial rejuvenation services, products, surgical things, what they're hoping to do is simply to look as young as they feel. And that's a reality. It has nothing to do with vanity. Not a single patient does this for superficial reasons. I've never met one. And to give you like the most simple extreme example, I had a patient who's literally lives on a ranch in the middle of Colorado, hardly sees anyone, like 5 hours from the nearest whatever. But her relationship with herself, to wake up in the morning and see herself look fresh, minus jowls, minus neck laxity, she was in her mid 50s or early 60s, whatever it was. And it was important to her. It really was important to be able to greet herself, to see the face that she expects to see. And that has enormous positive impact on other aspects of one's life. Like when somebody actually looks as young as they feel, they begin to carry on acting young, doing yoga, doing running, doing all these, physical activities that young people are supposed to do. And when there gets to be a point where it's like, yeah, I don't know if like I should be participating in that because I'm quote unquote old. There's so much wrapped up into that label you put on yourself that suddenly you start participating less in a lot of things that young people participate in because you're now categorizing yourself as old. And the surgery and the the treatments of the skin and all these other things enable somebody to basically prolong that aspect as much as possible, which ties in exactly with all the health span concepts that we're doing, because the reality is we're not even supposed to be around as long as we are, right? I mean, if you think about it from an evolutionary biology point of view, humans living healthy lives in their 60s and 70s, even just, when I was in training, my generation of our parents or whatever, like they were not living the way we're living at this age. 50 doesn't mean much, 60 doesn't mean much, but our faces don't know the difference, and we want that cohesion between the two.
Yeah, no, that's interesting. I mean, I've always said, I want to live a long time. I'm not sure I want to finish up as a raisin.
Yeah. No, exactly.
I was here before the podcast started, but this idea of shrinking and drying up. So, okay, so let me ask you, I have a bunch of different questions here, and I just want to throw them out and see where it goes. What's the importance in your mind of a person's genetic predispositions, like in terms of their skin? Like we see some people, like there's different reasons for how accelerated we age, right? Yeah. There's going to be lifestyle. If you're a smoker, a drinker, and a partier, if you eat a horrible diet, if you bake in the sun. I mean, I've done more sunbaking than I care to admit, but let's just say you spend way too much time in the sun. But then that foundational, those genetics is in your mind, does that play a role in how a face responds to your treatment, or even how early it needs to be done? And I mean, I know that's really personal.
No, so here's the thing. Think of it this way. This is the best way I can explain the concept of genetics in this. Basically, if you take a bell-shaped curve, right? The overwhelming majority, call it 90+% of human beings, and I would say women, 90% of them, are going to see the beginnings of what would be basically rapid facial aging starting in their late 40s and early 50s. This is when suddenly there's this transition that occurs, because the face is pretty much the same from the 20s, 30s, and even mostly through the 40s. It's not until the late 40s and early 50s that all of a sudden there's this transition starting to happen. Now, that's all comers, every single human being. And there's hormonal reasons, if you follow the estrogen curve, it literally follows exactly that pattern, which then ties to collagen curve, which follows the same pattern, which is more related to the skin issues. But the fascial laxity, it's like clockwork. Now you throw in good genetics, bad genetics. And what you're talking about is somebody who ages a little bit earlier might start seeing that sagging happening in their early 40s. On rare cases, even in their in their late 30s, very rare. But those are minor contributors. And then you take the good agers, the ones who have good genetics, whatever. They might be mid 50s.
Yeah.
Or late 50s when they start to see the. So you're basically talking a small sliver on each side. So my take is generally genetics is kind of an irrelevant piece to the whole thing, because there's two parallel pieces here. There's, when this laxity thing happens, it'll happen, right? Like, it just happens. But the one thing that you can actually completely bypass, the natural aging and senescent changes that occur, is skin aging. And a lot of people don't understand that those two things are completely separate. A lot of people just lump them together. Think, oh, if I take good care of my skin, I won't need surgery. That's not the case. You're just going to have really lovely looking skin. And when you do get surgery, you're going to look like a 30-year-old, because young skin and young shape are the two things that young people have. But a lot of people neglect their skin, or they think that it's like not something that they need to worry about until the day they do something big. And then they get surgery, and then their skin looks like 50 or 60-year-old skin on a 30-something-year-old shape, and that still doesn't look completely youthful. It looks a lot better, but it doesn't look youthful. But it's interesting that we actually have, and we can talk more about this if you'd like at some point in the podcast, but the skin is the one thing that we have full control over. So, you're talking about sunbathing, et cetera. That's like one really important lifestyle, smoking, et cetera. That's one aspect of it. But there's other things that you can do despite whatever genetic directionality, ethnic directionality you have with your skin. You can completely bypass all of that with some very fundamental, and basic steps that you can apply to your life to improve that. And it really does, when it comes to skin, it's literally exactly like the body, right? I mean, there's people in their 50s and 60s and even 70s, and sometimes even older, that are still fit and have, muscular and do all the things because they're doing certain things on a daily basis to preserve muscle mass and preserve, their cardiovascular health, et cetera. That applies perfectly to skin. It has literally completely uncoupled when it comes to laxity. And that reality is so key, because it saves, if you just accept that as the truth, it, and you're trying to plan what you want to do going forward, it puts everything into perspective, and you stop wasting time and money and research and this and that and the other thing and all these things that you think are going to somehow hack the system, and you can't hack the sagging system.
There's a piece of hacking you can't do. No, exactly. The laxity is interesting. For me, I was golden. It was between 55 and 60.
Yeah. So you're a little on the later side. So yeah, you're the good genetics, So that's not the normal. That's not. I would say that's like a little delayed on the spectrum.
Yeah, but it still happens.
A few percent. Yeah, it still happens. It still happens no matter what. That's the reality. It's like whoever and wherever they are, it's going to happen. And when it does, it just happens.
Yeah, for sure. So. Okay, and so let's talk about this, because obviously you're touching on this, and interestingly enough, like for me, it never really landed until a couple of years ago when these changes really started to become apparent. And I'm like, and I was a late comer to skincare. I'm not going to lie.
Most people are latecomers.
You're 20, 30 years old. I didn't wear makeup. I was like, I'm fine. I'm fine. And then one day you wake up and you go, I could probably use a little something, something, right? Yeah. And it goes from there. But this idea of the infrastructure versus the wrapping, right? So, and we talk a lot, in terms of the body's priorities as it's aging, skin doesn't really factor, right? Skin's like a barrier.
Reproductive, right? Post-reproductive ages. Body. Why does it matter to be youthful and beautiful looking? It's like evolutionarily. Why spend the energy on it?
No, evolutionary. It's a fail, right?
Yeah,
you don't want guys wasting time on that one.
No. Yeah. Exactly. That's the reality of the way our systems were designed, We're
programmed. Yeah. So let's talk about that infrastructure, because you mentioned fascia.
Yeah.
There's the fat layer underneath. There's bone, and all of these things interplay to create this, what you refer to as shape.
Yeah.
Youthfulness. That is really it's the trickiest part to reclaim.
Yeah. So you mentioned all three of them: bone, volume, which is fat, and then fascial laxity. I would put bone as the most irrelevant of them all. It really is not a major thing that needs to be directly addressed. the two that are very clearly needs to be addressed is fascial laxity. And when I say fascial laxity, so the way I look at the face, and this is honestly a bit more of a unique way of looking at it. I look at the fascia that attaches to your temporal bone up here.
Yeah.
That extends in through your temple, that includes the corners of your eyebrow, that goes down into the midface, that goes all the way down into the neck, and attaches down to the clavicle. Okay. All of this is basically one fascial unit. We have the different names for it. We call it temporalis fascia up here. We call this the SMAS. We call this the platysma. The reality is, if you were to follow them along, they're all one. And when you age, all of this, starting from the top, starts to drift downward. Okay. And when it drifts downward, the corners of the brows start to sag. You get heaviness around the corners of the eyes. The midface starts to go down towards the nose and the lip, so you get heavier nasolabial folds and a little bit of a groove down in the middle of the cheek. When it starts going down into the jawline, you start to see the marionette folds happening around the corners of the mouth, as well as the jowls hanging below the mandible, so there's hanging soft tissue. And then when that happens, there's nothing holding the neck up anymore, so your neck starts to sag forward and you get bands and irregularity and all this kind of stuff. So why I say it's different than the way most surgeons think about it, because the facelift by definition is a technique that pulls the jawline sideways. That's like the foundation of the facelift. It pulls the jawline. So then you say, okay, I'm going to pull the jawline. Then I'm going to also, in some people, I'm going to do a neck lift. And then in some people, I'm going to do a brow lift, right? So now, like, these are three separate areas that you're going to have to basically design the surgery around. Not everyone wants to do a brow lift, not everyone, necessarily. So what you end up getting is some people who do a neck lift only, but not do a jawline, tightening procedure, or do a brow lift, but don't do this. Like, there's mix and matches of the stuff. And that looks weird, because that's not how
it doesn't match.
It doesn't match. The system didn't age that way. So you addressing one or two parts of a 4-part system doesn't address the problem. So the vertical restore, which is a technique that I started doing around, I think it was end of 2017, 2018. Basically, instead of, even I was, before that was like calling these different procedures different things. Then I said, you know what? Why am I even giving the patient a choice on doing that? I'm going to lift it all up together. So I brought it all under one procedure. The vertical restore addresses the corner of the brow, the midface, jawline, and neck, and goes into a space called the deep plane, which is really, I think, an advanced, even though it's been around since the 80s, but it really is the most advanced way of doing things, because it releases all the ligaments, all the things that are basically functioning like an elastic rubber band, which is pulling downward. We release that and reset the position up higher without any opposing tension or force. So the durability and the level of correction is much greater in the deep plane. And so that becomes how you reset that nice V shape to the jawline and that area. Go ahead. You had a question.
Yeah. So when you release the ligaments, is there cost to that? Like, are these ligaments that just shorten or tighten up as we age, and they need to?
No. So they basically stretch. So they basically, you get like they tether things down, and the fascia around them sort of stretches. But the interesting thing is, in surgery, if you try to tighten a face without releasing the ligament, let's say hypothetically you only get an inch of movement upward. But if you release the ligament, now you get 2 inches of movement. So you actually get a full correction, which brings the face closer to where it was. But there's no, all those ligaments are doing is they're binding the surface of the skin, the fascia, down to the bone. So the face basically doesn't fall off. Like, there's a reason why, like, there's ligaments down here in the corners of the jawline that keep the soft tissues of the face from falling forward. That's why things fold over this area. And they, you know what I mean? So they're essentially holding things up, but the fascia around it has loosened. And so now, to get everything back up into position, you release them. And then once you resuture things, then they reestablish through healing, basically. Yeah. And then they form their own attachments again, and everything's secure in an upward position. Okay. And then in the middle of the face, then you've got volume loss that starts affecting the temples, the hollowness around the eyes, the lips lose volume. And then you get extra skin around the upper lids, the lower lids, and then in some cases, the top lip. That basically, those 5 categories, upper eyes, lower eyes, all this, which I call one thing, the fascia, the sides of the face, and the lip, all of that together is basically the comprehensive changes that happen with aging and bringing them all together from a shape point of view.
Right. So when you're restoring volume, I think you're using fat, right?
Yeah, I use your own bud's fat.
Yeah. So let's talk about. So, I mean, look, so it actually took away a whole bunch of questions, right? Because I was like, so what's the least impactful way to someone to rejuvenate their face? Is it their eyes? Is it the lower section of the face? Is it the neck?
You know the answer.
Don't even freaking bother.
Yeah. Yeah. No, it's like asking like if you're renovating your kitchen, you bought a home in the 1950s, you're renovating the kitchen, you ask your designer, hey, what's the least, but you're not going to just do your appliances and countertops and the floor and call it a day, right?
In fact, look, I mean, I renovated my kitchen last summer.
Yeah, there you go.
That is not changing the floor.
Yeah, exactly. Yeah, no, exactly. The whole
stupid floor, like the whole kitchen is stunning, and that's the floor.
Yeah. No, exactly. And that's the same thing happens with the face. But what's nuanced about the face is the minute you see somebody, the second, actually, nanosecond, you see somebody who has this disharmony between subunits of the face, meaning they have young parts next to old parts. Just like when you walk into a kitchen that doesn't have harmony, you look at a face, within a split second, you can tell something is off. And that something is off translates to they've had surgery. And they don't look quite human anymore, and that's part of the reason. So people can look unnatural, either because of poor technique, but also because of the poor combo that they've done. So there really isn't like a shortcut, easy way around shape. Shape is kind of like it's got to be addressed.
So let's talk about fillers, because it's, fillers and Botox are the shortcuts that people use, right? Yeah. And I'd love you to touch on this whole facial dysmorphia that happens, because I've seen it happen in people that I know where they're pumping up their lips or doing whatever. And the next thing you know, it's like the mouth almost loses its normal shape.
Yeah.
And they are completely oblivious.
Completely.
I'd be wearing a hijab at that point. But and no disrespect to hijabs.
Yeah. No. I hear you. Yeah, you'd be embarrassed by it. Yeah.
But I'd be fixated by it, right?
Yeah.
Something. But yet, for people who, it's almost like this crazy progression that they do, and then they somehow lose. And you see it even in celebrities, shockingly, because you would think people who have all the money in the world would just find you and do the thing. But where suddenly a person's face is no longer, it doesn't make sense anymore.
Totally, 100%.
They're completely disconnected from that.
Yeah. So it all goes back to kind of what we just discussed a moment ago, this sort of normal way aging occurs and a logical way of rejuvenating it. Fillers, as they've been introduced in basically the early 2000s and have really caught on a ton of, they were positioned originally as fill the nasolabial folds, fill the lips. Those were like their two, sort of uses. Then there were some things about filling under the eyes, etc. And then it became like more advanced fillers came out who were like, okay, you can fill your cheeks, you can fill along the jawline, and you can prevent yourself from needing a facelift, because if you put a bunch of filler in the sides of your cheek, what's going to happen? It's going to lift, right? So that was the injection designs were all like add cheek volume. And remember, as I said, when the cheeks come down, like this part of the cheek comes down, what ends up happening is you end up with a hollow across this area, right? It's actually not a hollow. It's your cheek falling. So when you fill the apple of your cheek in a cheek that has fallen, you're putting volume in a space that doesn't need volume. Anyone who's listening to this can literally do this in themselves. They'll take their finger on their cheekbone and go upward, and you can all of a sudden see that it adds beautiful volume in the middle of the cheek without having to add a cc of volume to that area. But guess where fillers are normally added?
Right
They're
here.
added to exactly that part of the cheek, this part of the cheek. They're added along the jawline. And so because what happens is there's this notion, and again, this is basically, I don't know, call it a myth, misinformation, whatever it is, that fillers go away in 6 months, 9 months, a year. So the idea is that if you get a filler done, I mean, people go in with this preconceived idea that get a filler done, you're going to need to redo it in about 6 to 9 months, maybe a year Most people, but by year it's like completely out. So if you want to maintain it, the practice is you do it every 6 to 9 months to maintain. So, and that's like, on an average. So what happens is, in reality, that filler never completely goes away. And now we have, MRI studies and all sorts of things that show like 5 years later, that filler is still in the face.
Somewhere.
So yeah, it's there. It's like hasn't come out. So you may have lost a little bit of it, but you haven't lost it all. So now you go in with the notion that you need to refill it with the assumption that you're back to baseline, which you're not. You add a little bit more, and you're stacking filler on top of filler. And it's happening slowly every time, thinking that it's all out and you're adding more. So you're not thinking your face is transforming. You just think you're just trying to keep yourself looking like you did the very first time. And then since changes happen slowly over time, people get used to their changes. And next thing you know, a year or two have gone by and their cheeks are twice the size that they were 2 years ago. Lips are twice the size that they were before. And everyone around them sees these changes but them. And usually, friends are a little bit, shy or embarrassed. They don't want to hurt someone's feeling by saying something, and it just keeps going. And unfortunately, we have seen some real disasters when it comes to, changing the shape of the face in the wrong way, putting volume in the wrong way. So, for example, when I put fat transfer, I never put any in the cheeks. No one gets fat in the cheeks. Like,
where do they get it?
They get it in the temples, they get it under the eyes, they get it above the eyes. They actually get it in this area called the pre-jaw, which is underneath the lip and along this part of the jawline, and a little bit in the lips. But the cheek, I lift back into position, so there's no need for volume. But we definitely lose volume in those areas that I just mentioned. But those aren't necessarily the areas that people are putting a lot of fat or a lot of filler when they're trying to lift the face. They're putting it in the cheeks, and the lips. Of course, the lips become like this trend concept, right? The Kardashians go off and get these massive lips, and then there was like this surge of lip filler demand that came up around. I mean, it's amazing what impact trends make in terms of when they're influencer based or whatever, and they change people's perspectives, thinking like that's the new beautiful or sexy look or whatever it is.
That's what a lip is supposed to look like. And and I think, to your point, what happens is it's very often not in isolation, like birds of a feather flock together. And so you have
like-minded, you're thinking, you're talking.
Friends are all morphing together. And
but I think the other thing that's really important to mention here for the listeners is that it's not just the shape that you screw up with the consistent use of fillers in the wrong places. It makes surgery literally 10 times harder.
So this is what I heard.
Yeah. Oh my God. I mean, I operate in fields with filler in all the time because I do a lot of surgery, so I see it every day. But it's so sticky, so obscured, so difficult to dissect where you need to be. And there's some really important structures, above and below you that you don't want to, basically mess with. And the filler makes it very hard to distinguish those areas because it just becomes a scarred in mess. And it is so different than operating in a face that hasn't had these things put in there. And I think that's the one thing, again, like I said, I do this all day, every day, every week. So I experience some advance of doing this type of stuff. So I don't necessarily run into trouble with it. But I always think if I was like earlier in my career and I was operating in the deep plane and I ran into all this like scarred stuff, it would really either cause me to back out and not do a really good job because I was afraid if I kept going, I would end up, I think it's a responsible thing to do to back out, which means the patient doesn't get a great outcome. Or if I was cavalier and push forward, now I'm really putting nerves and different things like that at risk because they're all kind of like mixed in with the scar tissue, and it's very hard to tell. So there's consequences that are severe, not to mention the financial consequences of these fillers over time, because, you talk about doing them regularly over time. I mean, people spend literally over time a fortune on a lot of these non-surgical treatments that effectively do nothing.
Can the fillers be removed, dissolved, or?
Well, the actual filler can, but the consequence of filler once it enters the tissues is your body's trying to break it down. What is a side effect of that inflammation process is scar tissue. Scar tissue can't be broken down. So even if you remove the actual filler by the enzymes hyaluronidase, the scar tissue is a scar tissue. It's already formed. So it's that stuff isn't going to go away. And there's a percentage that ends a scar, some of it that's lingering filler, and some of it goes away. So it's like those three potential post-injection outcomes.
Well, that sucks. Okay, let's talk about the other stuff. How about Botox?
Botox is actually really good from the point of view that you have to ask yourself the original question is, why do you suddenly need Botox in your late 30s or early 40s, but you didn't need it when you were in your 20s? And the reason is the skin becomes thinner with age. So the underlying muscles that are flexing like they did since you were a baby, suddenly on thinner skin causes skin to fold, and you can see lines and wrinkles. The primary point of view is I think this is an important area to discuss with the audience, is if you do things that are going to keep your skin thick, meaning robust collagen production, et cetera, you literally don't need Botox, because your skin's going to be like it was, functioning anatomically like it was in the 20s, which you clearly wouldn't need Botox. But if you are in the situation where you flex your forehead or squint your eyes and you get lines around it, those are dynamic lines when they only happen when you squint or smile. But over time, they become static lines. They're there no matter what. And what you're trying to do with Botox is prevent the evolution of a dynamic line from turning into a static line. And by basically weakening the muscle that causes the contraction, less impact on the skin, less likely for that process to transition into a static. So I think the key takeaway there is it's a very effective, very safe treatment to be done. It also doesn't need to freeze your face in order to get the effect from it. You can just weaken the muscle and take the oomph out of it so it doesn't have as much flexion into the skin, and you're still getting the preventative benefits from it. So I think there's a lot of misconceptions about how to use Botox. A lot of people, and I don't inject it anymore personally, like my nurse does, but back in the day, I think people really fought the presence of any line or wrinkle in their forehead or around their eyes, and really wanted like maximum dosages, which can look really weird too. So that's the thing. Like anything can be negative if it's done with the wrong paradigm.
So less is more, basically.
I think so when it comes to Botox. Yeah.
I would agree. I think that, again, I mean, it even impacts your ability to properly express yourself or communicate.
Yeah.
Right?
Oh yeah, totally.
There's studies that have been done with babies whose moms have had too much Botox, and it impacts their ability to communicate.
For sure. Yeah. Because you communicate with your eyes and your expressions. And if you can't express, then that's going to be, you're going to miscommunicate.
Yeah. Okay. So I'm going to move on to like some rapid fire stuff, but is there anything else on the facial rejuvenation that you feel we need to communicate or talk about?
No, I think we covered the surgical stuff really well, and we can move on to skin, or what people can do for their skin, which is, I think, probably the most actionable piece of information that people can take with them, changing their way they look at things. But
so we're going to finish with that. That's going to be the crescendo close.
Okay.
Before we get there, I want to throw some stuff at you, like red, green, blue light therapy. Like you get hit with all, I mean, you go on Instagram.
Yeah. No, 100% happy to.
I want to make my skin better. And the next thing, the ads that are popping up at you.
Yeah.
Like they're crazy town, right?
Yeah.
You've got the glass skin stuff from Korea, which frankly, I think Korean people just have better skin and they take care of it from the time they can speak.
Totally.
And so they have that crazy skin.
I'm happy to answer any of those questions and put all that into perspective.
Okay, so let's I want to put into perspective the light therapy, like so the red light, the infrared light, that kind of stuff, microcurrent devices.
Yeah.
We can touch on threads, but I will say to people, if you're curious about putting threads into your face, go to Dr. Karam's Instagram. I don't know where on your feed it is. Find the post where he was actually removing this woman's threads that were actually trying to work their own way out of her face. Yeah. And you will never think the word threads ever again. You can touch on it if you like. So that's enough to start with.
Okay. So when it comes to light, I'll just put light therapy into this category of, and in fact, microcurrent in the same sort of category.
Right.
There are fundamental things you can do to rejuvenate your skin. Fundamental, meaning that without them, everything else that you do is not really anti-aging skin,
Okay.
right? So light therapy and microcurrent fall into the category outside of the fundamental, meaning that there's nothing wrong with doing them. There's
Okay.
literally nothing wrong with doing them. There's no harm in it. There's some incremental improvement in skin tone, with microcurrent. There's incremental improvement and blood flow and potential even for collagen stimulation and all these other things with light therapy. But as a standalone, if this was, for example, all that you were doing was either of these or even these in combination, you're not getting anywhere with anti-aging for your skin. So that's important to understand that. But you can definitely, if you're wanting to add another layer on top of it, there's a lot of things you can add on top of it. So for example, in addition to microcurrent, light therapy, microneedling in the office is a great additional sort of treatment. Light chemical peels, a great additional sort of treatment. Yeah, absolutely. And I can explain why. And light laser treatments, laser resurfacing or fractional lasers. But so what I would say
On the foundation, what are the foundational things? Let's start from there because because I'm jumping ahead.
Yeah. I think it makes it easier to put it in perspective that way. So the thing is, it all comes down to collagen loss. That's what happens to skin. So there's two sort of parallel pieces. Collagen loss is causing anatomic changes to the shape of the skin. So if you look at young skin, it's thick. The dermis is packed with collagen and elastin and even keratin. And then what happens is, as you starting in the mid-20s and you follow the curve, there's a slow but steady decrease. And then once you hit perimenopause and menopause, there's a massive drop, fall off. Again, following the estrogen curve, it follows literally the same line. So there's kind of slow, then drop. When that happens, as it's doing that, skin is producing less collagen. The cells within the dermis, the fibroblasts, are producing less collagen. And as a result, skin gets thinner, less elastic, and starts to get fine lines and wrinkle. In addition, what's also happening simultaneously to skin is the melanocytes, which are the cells that produce pigment. They're suppressed when we're young, and then they start to release their suppression. And you start to see, years of sun exposure now manifesting in pigmentation changes, sunspots, discoloration, changes in tone, etc. So you've got thinning skin, lines and wrinkles, then you've got discolored skin. Those two things are probably the most visible, notable things that are happening with skin as you age. So what are things that are going to accelerate collagen loss? Sun, UVA, through basically it's a degradation process through metalloproteinases that are increasing the production or decreasing the degradation of existing collagen. Smoking does the same thing. So sun is doing that to it, but normal genetics, as we know, is doing that also. And then sun is also increasing the rate of pigmentation production. So you've got these two things that are related to environment, and then you've got everything else that's just simply related to what your body's doing genetically. So then you say, all right, how am I going to hack this? How am I going to get around this? It's pretty straightforward given the tools that we actually have. There are certain categories of active skincare ingredients that have been around for at least 4 or 5 decades. Retinols, topical retinoids, which is like retin A, retinols, vitamin A, they're basically vitamin A derivatives, vitamin B derivative, niacinamide, vitamin C, and certain peptides. These 4 groups basically stimulate collagen at the genetic level. They're basically going through the process of transcription and translation. The genes that normally shut down, they're reactivating them. So there's an increase in production of collagen. Skin continues to thicken. So you couple that with sun protection, then you're improving architecture and structure of skin. You're basically like, if you started this process in your mid 20s, early 30s, whatever it was, your skin's not getting thin. It's literally staying thick. And we see this on patients who've been doing this literally since, and they're 70 now, and they've been doing this their whole lives, and their skin looks no different than a 20-year-old skin.
Even though they've lost their estrogen,
Even though, see, that's the fascinating thing about it, because estrogen unopposed will turn down production of collagen. But remember, you're going through a different pathway and you're turning it on, not through estrogen, you're turning it on through retinols, niacinamides, vitamin C's, and certain peptides. So you're basically, because all that matters at the end of the day is what's happening to that fibroblast, in terms of production.
Okay.
Whether it's decreasing naturally or staying up because of estrogen or being stimulated through these topicals, as long as it's being stimulated and it's producing collagen, you're winning the skin aging game. And why sun is such an important aspect of that is because between the antioxidant effects or the oxidative effects of sun, in addition to this kind of increase in regulation of metalloproteinases, you are losing ground. While you're losing ground biologically, you're losing ground through this environment. So then you're like getting hit by two factors. So that's why you want to remove as many things as that can do that. Remove sun out of the picture, and then you start to see the curve start to go, from down to up, or stay up if you'd use this long enough. And so when we talk about Korean skin, for example, or a lot of people who have somehow, especially if they're our age, which was like the sun baking, no skincare age, when they're 20s and teens and whatever it was. Some people, they're much older and somehow they've knew from whatever reason the sun was bad and these individual actives were good, and they did them for like 30 years. And they're like in their 70s and their skin looks insanely youthful still. And you see this in people who turn turn it around at any point in time, whether they're 50 or 60, they start doing these things and you see their skin starting to turn around as well. And that's why from my point of view, I've always, it's like you can't have facial rejuvenation without young looking skin. Like the two things are together. And so from the beginning of my practice, I've always emphasized the use of actives and put people on good skincare regimens, et cetera. In addition to my surgical patients, we used to have a whole program after surgery at the 3-month mark where we sat down with them and educated them, had office seminars and all this kind of stuff, because it's that important to get this right, because there's so few things that you can actually impact, but the skin 100% can be impacted on that aspect. And this is not like an opinion. It's thousands of studies showing the impact on the nucleus of the fibroblasts.
Okay. All right. Well, we're going to come back to the skincare because I know you have a solution for that, which is fantastic. But I want to go back to some of these other things that people do.
Exactly. So that's where so this is exactly the point. If once you because none of the things that you just mentioned, light, microcurrent, et cetera, are powerful enough to change the curve. That's the point that I'm making. By themselves, they can't change the curve. They can give some enhancement, but they can't really make a dramatic effect on the curve. So coupling those treatments on top of it, wonderful. Totally go for it. Yeah, totally go for it. Like, for example, I'll give you my wife has for the last 15, 20 years has been doing those fundamental skincare, actives. Yeah. But she also does microneedling on top of it. Once every, 3 months or whatever it is, she'll do some microneedling, primarily in her case for her neck. And then she used to do once every 6 weeks, do like a hydrofacial, which is like a light chemical peel, and sort of a cleansing process to the skin. It's like a acid combined with like a suctioning of the pores or whatever it was. She doesn't do that anymore. But the idea was that there was some things coming from the hydrofacial, but the 80-90% of it was coming from what she was doing with sun protection and active skincare.
Mm-hmm. Okay. Yeah, I saw a video of her on a hike after her.
Yeah, with her sun protection. Yeah, totally. Yeah. She's been doing that. Not the facial shield thing, but the hat and the sunscreen. Diligently since her mid-30s, because we had a good dermatologist friend of ours, very close friends, explained this whole thing, this entire paradigm to me and her, and the aging effects that these things would have if you neglect them. And she took it to heart. I didn't really take it completely to heart because I'm just way more lazy than her. She would do the 8 or 10 steps, needed to do that, but I couldn't do it. But I would tell my patients to do it. I would definitely, pass that message along.
Well, also as a man, and I don't want to go there yet. I will do that after. No, because then we're going in many different directions. So I'm going to give you another group.
Yeah.
That you can address as a group. Vampire facials.
Yeah.
Face yoga. We already talked microneedling, and then gua sha, which is kind of like that whole lymphatic kind of thing. So thumbs up, thumbs down.
Okay. No, so all totally fine. No harm in vampire facials, no harm in facial yoga and gua sha and all that kind of stuff. Again, not a foundational treatment. Right. That's the thing with it. Yeah. Little incremental improvements. Even like gua sha probably feels good. It's a nice, sort of like personal ritual, whatever. Nothing wrong with it. I can't, there's nothing harmful. And it's not like when we talked about fillers or threads, like there's actual real consequences, infection and all these other things and deformity that can come of it. You're not going to hurt yourself doing that group of treatments. The reason why, microneedling and which is microneedling with your own plasma isn't sufficient enough. Although it's it's not even comparable to gua sha and facial yoga. It's definitely, from a collagen boosting point of view, significantly higher. The problem is just people don't do it regularly enough or often enough to keep that collagen stimulation consistently high. Because that's the thing. It's like, think about it from a exercising point of view. What's the best way to get your body in shape? Daily diet and exercise, right? Exercise every day, eat well, and then you throw a boot camp on top of it. Then you go in for an intense weekend or week or 2 week or 3 week period. You're going to get a gain. But imagine if you did it the other way, like you just did boot camps every few months. You're not getting anywhere. Your body's not getting in shape. You get in a little bit of shape during the boot camp or whatever it is. You move in the right direction. But then what happens when you go back to your couch and eat the, whatever you were eating before? You start to lose everything. So that's the problem with these type of treatments, is that they're, without the base being set on a consistent basis, the DNA of the fibroblasts is not getting enough consistent stimulation to actually build collagen and build momentum going forward. You're getting spikes and drops, which is better than nothing, but it's still not enough. Yeah.
Okay, great. You brought up something about sitting on the couch and eating whatever. How important is diet?
Well, diet, I would say, if you liken the skin to any organ in your body, right, which is, it's the largest organ in the body, and you liken it to that, then your diet, your healthy lifestyle, your diet is incredibly important in terms of your complexion and looking great and all that stuff. So there's different aspects. So biologically, remember, we're talking about, there's a cosmetic aspect of good skin, which is that brightness, that, lightness and all that kind of stuff, which it requires a whole nother, sort of conversation about what it takes to achieve that. But those actives that we're talking about are stimulating collagen, but without, if you're eating, tons of processed foods, sugars, alcohol, you're dehydrated, drinking lots of coffee, not taking good care of yourself, poor sleep, your skin complexion is not going to be bright and healthy the way it would be. I mean, even one night of poor sleep, you can see it in your skin. You totally can. You can see it, everything. Yeah, everything. So if the overall desire is to have really beautiful looking skin, then you got to treat your skin in the same idea that what it would take to have great healthy body. So eat really good foods, whole foods, varied foods. And the other thing is, to support the collagen stimulation that you're getting from all these other things that we just talked about, well, you have to have the building blocks for them. And collagen not only requires a proper set of amino acids, but also requires zinc, copper, and vitamin C. So you have to have like a number of different things. The surface of the skin is made of lipids, so you need a certain amount of fatty acids, fats, and things. So there's a lot going on that you definitely would consider your skin, from a diet
foundation. It's 100%. Part of that foundation.
Yeah.
Just so you know, in this mug, there's not coffee. There's bone broth.
There you go. Yeah, you're getting tons of collagen peptides through your bone broth. Yeah.
I just want to say.
Yeah, I love it.
I have a friend who was saying, through COVID, I didn't really tell people, but I would put vodka in my mug while I was in business meetings. I was like, that's one way of getting through. Okay. So we talked about all the things. Is there anything, even in the world of peels, is there anything people should really stay away from? Like, is there such a thing? I'm wondering, like, are there peels that are just too aggressive?
Well, yeah, for sure. Yeah, I mean, I don't even know too many people doing those deeper peels. When I was training, like deep phenol peels were a thing, because again, there's all these different paradigms. There's like all the wrinkles that you would see on the laxity, you would see if somebody thought, that's all related to the skin. So yeah, just like fry the skin, deep lasers, deep chemical peels, and all your laxity will go away, right? So people I don't think are doing those. That it was like take 3 months to recover. I mean, it was a nightmare seeing those patients go through it. But people aren't doing those like really intense peels, to my knowledge, really anymore. I don't hear about them. But I think the reality is a light chemical peel, like TCA, like phenol, and there's a number of different acid combinations, actually are really good. They help with pigmentation. They do that. But here's the problem with peels and lasers as a standalone, again, because remember, peels can help with pigmentation, so can lasers. They can help with fine lines and wrinkles and rejuvenating the surface of the skin. And more importantly, remember, the skin is there's so much more complexity in terms of what makes skin actually look old and dull. For example, the dullness is from a bunch of dead layers of keratinocytes that are just like laying on the skin. So when you look at it under a microscope, it's like onion, the surface of an onion before you peel it has a dull layer. Well, all that's like dead skin layers that haven't been turned over. Mature skin starts to look like that and becomes rough to touch. Well, what a chemical peel does is basically exfoliates all that. It removes that top stuff off the epidermis of the skin. So now you have this like more bright glistening layer that's coming through. That's like a quicker way to do it. Retinols improve cell turnover, improve that, and also micro peel as well. So there's that approach, but if you want to kind of jump to it, that does it. But the problem is the minute those peels stop, everything goes back to baseline, right? Pigmentation starts producing more. So I think of it as like leaves under a tree, right? So you go in there in the fall and the first week you clear out a bunch of tree, you come back next week, there's a bunch more, right? Yeah. But what the daily support is doing is preventing the leaves from falling in the first place. So you're suppressing pigmentation, for example, so that you don't require as much clearance of them because there's not as much being produced. It's a totally different, sort of paradigm around the process of managing the aging changes of the skin.
Okay, great. All right, let's get to the skincare, because that's the big nut. That skincare is kind of like going into the Chanel store and buying the makeup. You can't really afford the outfit necessarily, but you can afford the makeup, and it's we see it as a luxury. But I think skincare, and you've said this all along here, taking care of your skin is foundational to whether you're going to do facial rejuvenation, for whether it's because you can't afford it or because it's not in alignment with your goals or whatever the case may be. Taking care of your skin is a great way to manage this asset that we have, right? And put our best face forward, as it were. So let's talk about what goes into that great skincare. You've alluded to you talked about the vitamin A, the vitamin C, there's zinc, there's copper, and you talk about peptides. Now I talk about peptides a lot. Yeah. But let's talk about the peptides you consider to be really the core of skincare.
So here's to take one step back just to understand the spectrum, right? So just like we described how the face ages in 5 fundamental changes according to the face, well, the skin has its own comprehensive set of changes. Right. One of them is collagen loss, which is structure. Then we talked about pigment as a second category. Now, with areas that we haven't talked about, dryness of the skin, mature skin, loses hydration and becomes more dry. It starts to form pores and things get congested on the surface of the skin. It also, basically loses that kind of plumpness quality to it, and that's partially because of dehydration, et cetera. So when you think about those changes happening all across the board, if you're really going to get down to addressing the skin comprehensively, you're talking about, first of all, washing the skin properly, and there's a lot to washing too that a lot of people don't realize. Non-foaming cleansers are a lot better for your skin than foaming cleansers, for example. Washing your skin twice a day is really important. To get that set, the proper use of a good cleanser sets the stage for everything that's going to go on afterwards. Then you're talking about, okay, well, I want the skin to look a little bit more hydrated and a little bit more supple. Hyaluronic acid is a topical ingredient that's used to basically enter the skin, bring water towards it like a sponge, cause the skin to plump up, because mature skin again loses some of that water content of the skin and becomes dehydrated. Then you've got ceramides and things like that. We talk about oils being really good for your skin, because if the skin, for example, is dry and you want to improve the balance, even if it's oily, you want to basically provide the skin with a certain level of extrinsic oil so that the natural production of oil either decreases. So if you have oily skin, your body naturally decreases, or the skin naturally decreases the production of oil through that type of feedback. But also the other direction, if it's dry, you provide it with its oil, so you improve its hydration and oil content. Then pigmentation, there's like a whole host of things. Out of the 4 of those things that I mentioned that improve collagen also improve pigmentation. But then there's a bunch of other things that you use specifically for pigmentation, and a lot of them are botanical. So you put all these things together, including retinol and vitamin C. Now you're talking about like a lot of steps, right? And this is what I used to put my patients through, and with good intention, because that's all that was available. Because I wanted to get them the same type of comprehensive approach with their skin, so they use it and they're like, okay, I see changes and things are actually moving in the right direction, and that progress is actually reinforcing and it feeds itself. But the problem was, realistically, despite the fact that we would have this conversation with 100% of our surgical patients, is maybe a third of them could carry on with this type of a regimen, either because it got to be really expensive. It was like $600 to $1,000 of using, Skin Medica and Zeo and Obagi and all the things that were available in medical offices. But the number of steps were just too much for people to do. Mm-hmm. So after 15 years of doing it that way and being frustrated that I'm spending like all this time helping patients try to figure this out and they can't, that's where I had my little aha moment of like, why can't we just put all this stuff together and do it in literally just a couple steps or one step, and just instead of me talking to everyone, I would just put all my surgery patients on this thing. So that process led to this whole, development of what's now called the trifecta. It wasn't thought to be that at that time, but basically the idea was put every single thing that you can possibly imagine the skin needs all into whatever, just so people can do it consistently and see the changes over time. So whether you do it through like, if your problem is, hey, I can't manage all these steps, or your problem is, I don't know what I should be putting on my skin, it sort of solves for that. But the reality is, it was never designed to be a product sold to people. It was literally a product that was basically for my surgical patients only.
Surgical care.
Yeah, because it was. I never had. I wasn't going to go create like a company or a brand to sell this thing. It was really. I didn't have like a social media audience and all this other stuff. That all happened towards the end of the formulation phases. As this thing kind of like, because it took about 4 years to develop it. Mm-hmm. And so for me, the more you understand about what happens to the skin, just like the more deeply you understand what happens to the structure of the face, the more you realize that you have to do it the right way in order to get the real changes. And that's kind of that's the concept there. So literally, a simple guide would be to go look at all the categories that are in the trifecta and go out and buy individual products for them. That's one way to do it, or you do it all together. But the challenge sometimes is, from a chemistry point of view, mixing and matching different pHs and things like that can sometimes have offsetting effects. And that was a formulation challenge we had in developing the thing.
Yeah, well, respecting the skin mantle is, that pH of the skin, the biome of the skin that nobody really talks about.
No.
It's a massive piece of the puzzle as well.
Huge. Yeah, it has to be, people put stuff on their skin and it burns a little bit. There's a little tingling, they call it stingling, that type of thing. Like, that's not good. If that's happening, your skin is basically giving, it's telling you, hey, this is not it's not a good thing to be putting on me, So there's like, there's so much, the problem with some of these actives like retinol and vitamin C, there's so much misconception around how to use them that half the people who are even attempting to use them aren't using them the right way, meaning they're not using them on a daily basis, et cetera. And that could be because their skin is refusing it, because it's, I don't know if you've ever tried Retin-A's or retinols, but it for a lot of people, it's a hard thing to adjust to,
Yeah, well, the ones I use tend to be, they're maybe a little less strong. So you have to use them more consistently, which not always the best. So they don't bother my skin.
Yeah.
But I remember once, have you ever heard of a product called Celex C?
No. So, I don't know much about it. I honestly don't know the product landscape that well.
So this is going back over 20 years ago.
Yeah.
Some esthetician had handed me the stuff. She said, this stuff is the bomb. It's vitamin C. It's amazing for your skin. And I'm like, okay, cool. So, 30-year-old or whatever I was then, me, says, okay, fine. So I go and I put this. And one day I'm staying at someone's house and the bottle spills. And it was polished granite. It ate the finish off the granite.
Oh, geez.
And I was like horrified.
Yeah, this is going on your skin.
Fortunately, the person where we were staying is like, they're in that business. And so they sent over the crew to fix it. And the guy looks and goes, what happened? And I'm like, I told him, and he goes, you're putting this stuff on your face?
Yeah, that's insane. Yeah.
It's like,
well, that's honestly, that's part of the story too, is first of all, just like the experience you had, that's how people usually come to arriving at what they should put on their skin, is typically like a friend tells them, or the esthetician or dermatologist or whatever. And if you ask, and my trouble has always been, even if you came to our office back before the trifecta existed, if you came to our office and you talked to my esthetician, same patient, talk to my esthetician, then the next day went talk to my nurse, and then talk to me, you're going to get 3 different regimens given to you.
Oh, wow. Yeah.
There's no consensus on what exactly, because each of these, menus, basically we had 20 different things to choose from to basically put together. I mean, it's confusing enough for quote unquote the experts, the people who know. The poor patient who's literally just getting, wants just, hey, what's the best? How could 3 people give you 3 different things and all 3 of them be right? You know what I mean? You can't. I wouldn't even trust my own, that mine was the right among them. You know what I mean? So there was a lot left. There's a lot left to be desired in that whole space. That's where kind of like, I felt like a void needed to be solved, just like the void of a natural looking facial rejuvenation needed to be solved, This void of an effective and simple and just a mindless type of a skincare regimen also needed to be solved. And so from the point of view of like, you can trust it and not have to question it and turn off your brain on that whole area, which ultimately I think is what I've learned from my surgical patients, is the biggest gift that they get is they stop thinking about their faces after surgery. You know what I mean? They just literally stop thinking about, and the patients who've been on, or patients or customers who've been on trifecta for 2-3 years, they're like, I stopped looking at anything related to skincare. Like, this is it, it's done. I know I'm getting what I need. So that mental space being cleared and being liberated is actually worth a lot for a lot of people, you know?
Okay, 2 more things. So do you want to talk a little bit about the peptides that are in your product? Do you have like GHK?
Yeah, no, we use acetyl tetrapeptide 2, which is principally basically enhances elastin and collagen stimulation. And those, again, the name of the game for us is stimulate collagen, stimulate elastin, and in synergy with niacinamide, retinol, and vitamin C, that's the peptide that we chose to put in there.
Okay. Yeah. And then the last question I have for you, because I feel like we've already answered a lot of the questions I could ask at the end, which is, well, what are the most important things people can do? You've kind of talked about that already and all that kind of stuff. How long does it last? If
the surgery?
Somebody does a vertical restore. Yeah. And so number 1, how long does it last? And number 2, does it basically turn the clock back so that now you're aging from that face forward?
Yeah. Super good question. So here's the best way to answer it. So I'll answer the second part of your question first. So you set the clock back. Let's say you're 50, you look, early 40s or late 30s, whatever it is.
Yeah.
So now from that point forward, for the rest of your life, absolute rest of your life, you're going to age completely differently than normal biological aging, meaning super slow, super gentle, super gradual. So that little bump phase that you had at your, late 40s, early 50s, you'll never have that phase again for the rest of your life.
Right, because that was physiologically driven. Yeah.
So now, because that was biologically driven, and now you've like messed with the biology and you mess with the anatomy, and there's fibrosis and healing and all this other stuff, and everything's being reset into positions. So it's not normal. It's not normal tissue anymore. Now it's been like surgically altered tissue. It's way more durable. So what that means is, like, let's say hypothetically, this is the thought experiment. If you had the procedure at 45 before you even needed the procedure. Mm-hmm. Literally hardly any sagging. You just did the procedure at 45. Then you go into perimenopause and menopause and go forward. Your face isn't aging.
Really?
You bypass the whole thing. You literally bypass the entire thing. Yeah. And then, so that's a very powerful concept. And that effect lasts you an entire lifetime. Again, assuming it's a properly done lift, because there's a lot of variations in the way people do lifts, and mini lifts and things like that aren't going to give you that effect. But let's assume it's a properly done lift; it's going to give you that effect. As far as durability or longevity, I always think about it as there's a reasonable time that people should expect these things to last, if the goal is to keep your face looking again like a 30-year-old, right? So if your idea, like let's say. Like we just recently operated on a 70-year-old, and we posted her entire journey on Instagram. I don't know if you probably saw that. It was really fun to share her journey. Her name was
shockingly good, even in the door though.
Exactly, because she had a lift done when she was 60. So she had her first lift when she was 60. Then she has this lift with me at 70. But as a 70-year-old, she didn't look like a typical 70-year-old because she had the lift when she was 60. Now when she sits back anatomically, her jawline, I mean, I always look at it as, if your jawline doesn't have laxity, if your neck doesn't have laxity, then you're basically like 45 and below. Like that's just a chronological point. Yeah. So she's going to be 70 having the jawline and tissues of a 40-something-year-old. And that was her goal, because she's a super vibrant, super young woman that wanted to feel like a 40-something or whatever age that she was in, wants to feel that way. But if she didn't and wanted to let it flow, then obviously she would still look great as a 70-year-old, right? I mean, for her age, she looked amazing. So it all depends on where you want to kind of like renew. I think of it as like painting the walls in your house. Some people have like a very low threshold for the first few scratches. They want to repaint the whole thing. And then other people can live with a little bit of a worn looking wall for a while before they repaint it. That's kind of how our patients are. Some of them are like, first sign of aging, they want to do something. So I think with a vertical restore, any type of properly done deep plane, you're looking at a minimum of 10 to 15 years, maybe longer. That's kind of like the range if you want to keep it looking pretty solid. My previous facelift technique, which wasn't a deep plane, was giving people a solid 10 years. So I expect there to be at least an extra 5 years with a vertical restore. Right.
And that's assuming you just want to keep looking the same. Like there's a
exactly
where you might say, look, if I can be 70 looking like I'm 55 and I can be 80 looking like I'm 60 or whatever,
you're good.
I'm happy.
100%. So. That's exactly right. The minute you do it for the rest of your life, you're never going to look like that age group again.
Yeah.
Like you won't look like an 80-year-old as an 80-year-old. You won't look like a 70-year-old as a 70-year-old.
All right. All right. Is there anything we didn't touch on that you feel people need to know? I mean, I think we've delivered a fair amount of.
Yeah, I think this was super. Yeah, I think this was super informative. I hope if people feel that way, because definitely there's a lot of good information here.
Okay, well then, where do people find you, Dr. Karam? First off, I'm going to interject here and say, head over to Instagram and follow this man, because it's super cool to see the work that you do.
No, I appreciate that. Yeah.
Where do they find you? And do you sell Trifecta to other people now?
Yeah. Oh, yeah. Now, so there. I would say for people who love this type of information, the Instagram channels to get into is the my personal one, which is at Dr. Amir Karam, and just make sure you don't go to there's a lot of imposter accounts out there. I always tell everyone, make sure it's the blue check, and around at this moment around 650,000 followers. So make sure you don't accidentally follow one that there's this weird. It's a whole different story, but but don't fall for any of those fake ones. And then for more skincare information, it's Karam MD Skin. Which is the Instagram. And then for people who want a little bit more deeper sort of discussion about stuff, YouTube is another really great space. We have tons and tons of content in there, and that's the same handle, Dr. Amir Karam. And for people who want to learn more about the actual trifecta and look at it on the website, it's karammdskin.com.
karammdskin.com. And I've said your last name wrong all along. After
that's all right. People go both ways. It's fine. Yeah.
I didn't ask it.
Yeah.
So I apologize for that.
It's okay. It's okay.
Anyway, thank you so much for
my pleasure. Thank you for the invitation. This was a lot of fun.
Yeah, it was great to meet you. And I look forward to doing a part 2 sometime.
Yeah, absolutely. Happy to do that.
All right. Take care.
Take care.